So, in the first of our torsion and acute scrotum for children explainers, I'm going to explain to you why children have worse outcomes for torsion than adults do. And they have worse outcomes because they come to hospital late, that they are transferred between centres, and that they undergo unnecessary investigations. And I'm just going to talk you through the evidence for this right now. And we all know that the critical time period to get to hospital with a torsion of testes between 6 and 10 hours. After this, the likelihood of salvage at surgery drops off like a cliff edge. And what we know about children is actually only in some regions a third of children actually present within a time frame that we would be able to salvage the testes. And if you look at the average time to presentation for children with testicular pain, it can often be 23 hours, which seems to be pretty consistent across the board. And part of my research has shown that the reason children present late is because the process is really difficult and the knowledge is really poor. So what's the evidence that children and young people do worse when they get transferred? Well, the evidence is pretty overwhelming. So if you look at this study from America, you can show that the rate of orchiectomy for torsion when children are treated in the first centre is 15, whereas a 30% rate if the children are transferred. And these are all children also who are presenting within 24 hours, so they're excluding the children that would have automatically received an orchiectomy. So in this case, transfer clearly makes things worse. And a piece of work from the UK again shows overwhelmingly that in a region where a work was done to what we call decentralise, so to get more children operated at the first centre they present at and to set out regional guidelines, then study this and showed that the orchiectomy rate when the children were treated at the first centre was about 16%, and that really makes sense, and that it became 60% for those who were transferred. Again, overwhelming evidence that children should not be transferred if at all possible for torsion of testes. And of course then back to unnecessary investigations. And of course we're talking about this guy. We're talking about ultrasound scrotum. And as you can see, the average time for scrotum lies just under an hour, with some children being delayed up to an hour and a half to have their ultrasound scrotum. If you can believe that, imagine that. Only a small number of children are getting to you with enough time to take them to theatre. These crucial hour differences could mean difference between salvage and orchiectomy for children. We'll talk a bit more about when ultrasound is safe and how it can be used in the acute scrotum setting in a separate video to today. So I hope I've convinced you. Today that there's an evidence for why children have worse outcomes from torsion because of late presentation, transfer predominantly, and unnecessary investigations. Therefore, I do think that we ought to be working together to ensure that all these risks for children are minimised as much as possible within our regions and nationally, and look out for some support and some work to move this forward.